This is the Injury Report presented by NYU Langone Health. Mets fans got some injury news about one of their young arms on Tuesday as the team announced that rookie starter Christian Scott has a UCL sprain. So what does this mean for Scott and the Mets moving forward? Well, we're going to discuss it on the latest edition of the Injury Report. We're going to do it with a doctor. His name is Michael Alaia of NYU Langone Sports Medicine. Dr. Alaia joins me now. Dr. Alaia, how's it going?
Great, man. Great to be here, Dexter.
Yeah, glad to talk to you about this. We don't like the injuries, but good to break it down, let the people understand what's going on and what can happen here. So, Doc, after announcing the UCL sprain on Tuesday, the Mets announced on Wednesday that they will be shutting down Christian Scott for 2 weeks before ramping him back up. Manager Carlos Mendoza, he stated that he feels pretty good that Scott will return this season. So, considering Mendoza feels good about everything with his pitcher and they're shutting him down for just 2 weeks, is this injury likely not that severe, and is Scott in any more danger of further injuring his UCL if he pitches later this season?
Well, I think it's good news for now, and we hope that it's not very severe. So obviously they've already obtained an MRI, and the MRI made it look as though there were no complete tears or high-grade partial tears, hopefully just a small sprain of that ligament. So maybe they saw a little bit of fluid around the ligament. I can't really make those conclusions because I've not been privy to the actual scans themselves. But when someone comes out and says it's a low-grade sprain, shutting them down for maybe 2 weeks and then ramping it back up, that's obviously very, very good news for somebody on the outside looking in.
Yeah, seems like it's good and encouraging news for the Mets and their fans, and also Christian Scott as well. So after feeling elbow discomfort and having an MRI, as you just mentioned, they diagnosed him with that UCL sprain, placed him on the 15-day injured list. Tommy John surgery is always the immediate concern for the team and fans. So at what point would doctors decide if Tommy John surgery is the best course of action here?
So first and foremost, if that tear got worse, whether he had a re-injury and a new MRI showed more damage to that ligament, then one would think that Tommy John surgery might be inevitable or be in the cards. Or if he continued to have significant pain while throwing and he couldn't get through a basic rehabilitation program or other treatment modalities like injections, if he was failing those particular treatments in the algorithm, then you kind of have to start thinking about the next step. And unfortunately for a lot of pitchers, as you know, those next steps often involve Tommy John surgery.
Yeah, and that is what the pitchers, fans do not want to hear at all. Now, during this 2-week shutdown period and moving forward, is there anything that Scott can do now to recover or heal that sprain that has occurred?
Yeah, I mean, right now it's all about rest and changing the activities or modifying the activities to avoid stressing that ligament. That ligament is the most important ligament on the medial side of the elbow, which is right about here. And that ligament gets stressed every time somebody goes into a late cocking phase or an early acceleration phase of their pitch. So if we can avoid those things, then we're giving the ligament a chance to heal, the ligament to sort of get better from this injury that it's got. Now, there are other treatment modalities as well with physical therapy. They can do modalities, stim, they can do injectable options. There's PRP, which is platelet-rich plasma. Sometimes people advocate for those injections because those can endorse a little bit of healing of that ligament. So they've got a lot of tools in their box, and I'm sure they're going to be using them, and hopefully the news is going to be good in the next few weeks.
That is the hope, but rest is the important part right now for Christian Scott, and we'll see how that goes. Now, Doctor, we know this over the years. We've seen more and more pitchers and baseball players have their seasons end because of Tommy John surgery. You just alluded to that. Why has this become such a common phenomenon in baseball, and is there anything that players can do to prevent it earlier in their careers?
Yeah, these are hard to prevent. The first thing that we talk about is sports specialization, right? You see kids 12, 13 years old going out there playing baseball and pitching every day a week, 60 to 80 pitches per week. That's the absolute worst thing that you can do. We always advocate with the AOSSN and our national governing bodies that we want athletes to really play multiple sports so they're not stressing the same ligaments over and over and over again, the same tendons over and over and over again. So early sports specialization, we don't love to see that. We like people to play different sports. And then it's more about how they're pitching. What are their mechanics like? If they're torquing through too much through their elbow, or they're trying to throw 120 miles an hour, or really stressing that elbow with certain pitches like curveballs, et cetera, then that could place people at higher risk. But the reason that people are really hurting themselves more often than this is because, again, they're throwing 120 200 pitches a week, and they're not limiting their pitch count. They're not giving themselves enough rest between the starts or between the practices. So they're really just asking way too much of that ligament. And honestly, people are getting stronger and stronger. Our muscles are getting stronger and stronger. We've got more and more training, but even though we're getting stronger, that ligament is really staying the same in terms of their strength.
Right. Now, over pitching for those young pitchers can be very detrimental. So you want to have that balance there, as you mentioned. Got to ask you this, because it's the worst case scenario here that Mets fans are going to want to think about and know about. If Scott has to have Tommy John surgery, he would likely be sidelined until 2026. Why, and this is a question I always hear from a lot of people about this, why is the recovery period after Tommy John so long?
Yeah, it's a balance between healing, mechanics, and strength. So when we're doing Tommy John surgery, essentially that means we're putting a new ligament in place of where that ulnar collateral ligament was. So either we can use a part of the patient's own tissue, or we could use something called an allograft, which is a donor piece of tissue. But either way, that tissue has to really heal before you start to stress it. So that's phase one, right? Early healing, early mobilization, etc. Then once that thing heals enough, then we could start testing the waters, but that takes time also, meaning a throwing program. They start with light, gentle throws, then they progressively increase their distance, their speed, and that takes a long time as well. So it's very, very common that we see pitchers be out at least a year, at least 12 months, not just for the healing, but also for the early and the late rehabilitation part of the program.
Yeah, and Mets fans hoping that Christian Scott will not have to go through that long process at all, but it is a process indeed, and hopefully he is able to bounce back from this UCL sprain. That is Dr. Michael Alaia of NYU Langone Sports Medicine. Doc, good to talk to you. Appreciate the breakdown. We'll do this again soon. Thank you so much.
Awesome to be here, Dex. Take care.